Hi everyone, still here with you is Dr. Foster Diala. In this session, we are going to be talking about the prevention of cervical cancer and the treatment. First of all, I will discuss how you can prevent getting infection by human papillomavirus, and secondly, we will talk about prevention of cervical cancer itself when you might have gotten infected by the virus. And lastly, we will discuss the treatment of cervical cancer and follow-up measures. Stay tuned. Prevention of cervical cancer. What are the necessary steps we need to take in order to prevent getting infected by the human papilloma virus? Number 1, abstain from sex. Do not have sex. Yes. Number 2, if you must have sex, use a barrier such as condoms. Also limit the number of sexual partners you have. Number 3, get vaccinated against the human papilloma virus, HPV. We thank God for the medical knowledge and medical technology that developed vaccine for the human papilloma virus. This vaccine is called Gardasil, and it has been approved for both males and females ages between 9 years to 26 years. Boys and girls are encouraged to have this Gardasil vaccination before they become sexually active. This way, they would be protected from infection by HPV. So parents, take note and guide your words well. So Gardasil protects against the 2 strains of HPV which have been implicated to cause cervical cancer, that is HPV 16 and 18, which cause most cervical cancers and implicated in most precancerous lesions involving the cervix, the vagina, and the vulva. It also protects against the types of HPV, example HPV 6 and 11, which are implicated to cause about 90% of genital warts, skin warts, etc. You need to stop smoking if you do smoke, and don't start smoking if you don't smoke. So complying with all the above would protect you from getting infected by the human papilloma virus. Now, let's go into prevention of cervical cancer. Having routine pap smear or pap test would help in preventing cervical cancer. So pap smear is a procedure in which your OB/GYN doctor scrapes or brushes the cells around the cervix and goes ahead to examine them in the lab, searching for changes in the cells of the cervix. This helps in detecting the cervical cell changes early enough before they become cancerous, and you are encouraged to have regular pelvic examination. So if by pap smear or pap test precancerous lesions, precancerous cells are detected in your cervix, you can be properly monitored and treated to prevent cervical cancer, because the cervical cancer is a very slow growing tumor. It can stay in your system for 10 to 15 years before you start feeling symptoms. I've said that before. And when detected early enough, it can be treated almost 100%, and you will be free. So most medical organizations have suggested that women should start pap smear examination, pap smear screening from the age of 21 or when they become sexually active. And this pap smear should be repeated every 3 years. Women between 30 and 65 years of age can get both pap smear and HPV test every 5 years. If you are beyond 65 years of age, you may stop testing if your doctor has told you that you are low risk. If your cervix has been removed surgically and you have no history of precancerous lesions or history of cervical cancer, you may also stop testing. However, if you are sexually active and have high risk of sexually transmitted diseases, you have to get tested for chlamydia, syphilis, gonorrhea, HIV more often. So what happens during pap test? During pap smear, the doctor scrapes and brushes cells from your cervix, and they are examined in the lab for abnormalities. In HPV DNA test, the cells collected from the cervix are tested for any HPV strain that could cause cervical cancer in the future. So, if you as a woman have bleeding after sexual intercourse, or you have intermenstrual bleeding, meaning that it is not yet time for your next period and all of a sudden in between you start seeing blood again, or you go for pelvic examination and the doctor removes his or her hands and the fingers are stained with blood, you are also stained with blood, or you are already a post-menopausal woman who has stopped seeing her periods, but then all of a sudden you start bleeding again. If you have all these signs and symptoms, please go and see your OB/GYN doctor to be properly screened and tested for HPV infection and cervical cancer. Though there are other medical conditions that can lead to intermenstrual bleeding, postmenopausal bleeding, which could be as a result of dryness of the vagina or other reasons, but prevention is better than cure. There is no harm in screening yourself properly so that you will be safe in the end. Now let's go into cervical cancer treatment. If cervical cancer is suspected, your doctor would most likely do the following. Your doctor would do proper examination of your cervix and other tests to confirm your diagnosis. If the diagnosis of cervical cancer is confirmed, he would go ahead and stage the disease, because cervical cancer treatment depends on several factors like the stage of the cancer, your own personal preferences, and other health problems you may have. Your treatment options may include surgery, chemotherapy, radiotherapy, or even a combination of the three. Regular pelvic examinations and pap smears are very important, especially for women who have had precancerous cells or cervical cancer. The good thing about cervical cancer is that it is preventable, it is treatable, and survival rate is almost 100% if detected early. If detected early and the precancerous and cancerous changes treated promptly. For the cervical cancer, which is already invasive, which has already invaded neighboring tissues, organs, and distant tissues, the prognosis, that is, the survival rate, depends on the stage of the cancer. With this, I will come to the end of this discussion, and I hope you have benefited from this discussion so far. So, like this video, comment, ask your questions as usual. I'm here for you to answer your questions and to guide you. Open up, delay may be dangerous, and silence is deadly. So, share this video to everyone. Thank you very much and God bless. Bye for now.